Today's topic is a spice we all know and love: ginger. While it's renowned for its health benefits, there are times when ginger might not be suitable for everyone. In this detailed guide, we'll explore 9 specific occasions where you should think twice before reaching for ginger. Experts in the field of health have carefully examined and supported each point. Ready to dive deep into the world of ginger? Let's get started. Medical disclaimer: this video is for informational and educational purposes only. 1. Bleeding disorders. Ginger is famous for its blood-thinning properties thanks to compounds like gingerol. This can be a concern for those with bleeding disorders like hemophilia or von Willebrand disease. Ginger can exacerbate bleeding tendencies by inhibiting the formation of blood clots. This effect, while beneficial in preventing blood clots in some cases, can be dangerous for individuals with bleeding disorders. It may increase the risk of spontaneous bleeding or prolonged bleeding after an injury. Additionally, ginger can interact with medications like warfarin or aspirin, commonly prescribed to manage these conditions. These interactions can amplify the anticoagulant effects, potentially leading to serious bleeding complications. Individuals with bleeding disorders must consult their healthcare provider before incorporating ginger into their diet. This consultation ensures that they can enjoy the benefits of ginger without compromising their safety. 2. Diabetes. For people with diabetes, managing blood sugar levels is a daily priority. Ginger, though beneficial for its anti-inflammatory properties, can also lower blood sugar levels. This hypoglycemic effect can be a double-edged sword for diabetics. On one hand, it can aid in managing high blood sugar. On the other, it can cause blood sugar levels to drop too low, especially when combined with diabetes medications. Symptoms of hypoglycemia, such as dizziness, confusion, and even fainting, can occur if ginger is consumed in large quantities. Furthermore, ginger's interaction with diabetes medications can be unpredictable, potentially disrupting the delicate balance needed to manage the condition effectively. Regular monitoring of blood sugar levels is crucial for diabetics considering ginger in their diet. Consulting with a healthcare professional can guide how to incorporate ginger safely, ensuring it complements rather than complicates diabetes management. 3. Gallbladder issues. Ginger's effects on the gallbladder can be problematic for those with gallbladder diseases such as cholecystitis or gallstones. The spice's ability to stimulate bile production is usually a positive attribute, aiding in digestion and fat breakdown. However, for individuals with gallbladder issues, this stimulation can lead to discomfort and exacerbate existing conditions. Increased bile production can cause gallstones to move, potentially leading to gallbladder attacks characterized by severe pain, nausea, and vomiting. Furthermore, ginger's blood-thinning properties add another layer of concern. Despite being uncommon, ginger's anticoagulant properties could make any bleeding issues in the gallbladder worse. Individuals with gallbladder issues need to be cautious with ginger consumption. Seeking advice from a healthcare professional can help determine whether ginger is safe for them and suggest alternative remedies for digestive health that won't aggravate their condition. If you're finding this information valuable, please take a moment to like and subscribe to our channel. Your support helps us bring more health insights to you. Now let's continue with our list. 4. Heart conditions. Heart health is a delicate matter, and ginger can have significant effects on those with cardiovascular conditions. Ginger's ability to improve blood circulation and lower blood pressure might be beneficial for some, but for individuals with heart conditions, these effects can be risky. The increased blood flow can strain an already compromised heart, potentially exacerbating conditions like heart failure or arrhythmias. Additionally, ginger's blood-thinning properties might interfere with prescribed heart medications, particularly anticoagulants. This can lead to an increased risk of bleeding, a serious concern for those with cardiovascular issues. It's also worth noting that ginger can affect blood pressure. For those with fluctuating or uncontrolled blood pressure, ginger might cause unexpected spikes or drops, complicating their condition. Heart patients should approach ginger with caution and always consult with their cardiologist or healthcare provider. This ensures that any use of ginger is safe and complementary to their existing treatment plan. 5. Medication interactions. Ginger can interact with various medications, altering their effects and potentially leading to health risks. This is especially true for blood thinners like warfarin and aspirin. Ginger's anticoagulant properties can amplify the effects of these medications, increasing the risk of bleeding. For those on high blood pressure medications, ginger can either enhance or counteract their effects, leading to unpredictable blood pressure levels. Similarly, ginger's influence on blood sugar levels can interfere with diabetes medications, either reducing or exacerbating their efficacy. Other medications, such as those for heart rhythm disorders, might also interact with ginger, leading to potential complications. Individuals on any long-term medication must discuss their ginger intake with their healthcare provider. This conversation can help identify any potential interactions and adjust dosages or dietary habits accordingly to maintain safety and treatment effectiveness. 6. Underweight issues. Ginger's metabolism-boosting properties can be a concern for individuals struggling to maintain or gain weight. Its ability to enhance digestive enzyme production and speed up the metabolic process can lead to increased caloric expenditure. This might be advantageous for weight loss, but poses a challenge for those who are underweight. The increased metabolism might result in reduced nutrient absorption and difficulty in gaining weight. Additionally, ginger's potential to suppress appetite can further complicate efforts to consume enough calories for healthy weight gain. For those dealing with underweight issues, ginger should be used cautiously. Consulting with a healthcare provider or a nutritionist can provide tailored advice on incorporating ginger into a diet in a way that supports rather than hinders weight management goals. Alternative digestive aids that don't accelerate metabolism or suppress appetite might be recommended to ensure nutritional needs are met without compromising weight gain efforts. 7. Pregnancy. Pregnancy is a time when dietary choices are scrutinized for the safety of both mother and baby. While ginger is often recommended for morning sickness, its consumption during pregnancy should be carefully considered. High doses of ginger have been linked to an increased risk of miscarriage, particularly in the first trimester. This risk, though small, necessitates a cautious approach to ginger intake. Additionally, ginger can exacerbate heartburn and gastrointestinal discomfort, common issues during pregnancy. Its blood-thinning properties also raise concerns, especially closer to delivery, as they could affect the clotting process during childbirth. Pregnant women should consult with their healthcare provider before including ginger in their diet. This ensures that its use is safe and beneficial, taking into account individual health considerations and pregnancy-related factors. In some cases, alternative remedies for nausea or digestive discomfort might be suggested to avoid any potential risks associated with ginger. 8. Low blood pressure. For those dealing with low blood pressure or hypotension, ginger's impact needs careful consideration. Ginger's compounds like gingerol act as vasodilators, widening blood vessels and lowering blood pressure. While this can be beneficial for high blood pressure, it poses risks for those with low blood pressure. A significant drop in blood pressure can lead to symptoms like dizziness, faintness, and even loss of consciousness. Furthermore, ginger's blood-thinning properties might exacerbate these effects, especially if combined with blood pressure-lowering medications. Individuals with low blood pressure should monitor their ginger consumption and discuss it with their healthcare provider. This conversation can help determine the appropriate amount of ginger in their diet, if any, and prevent any adverse effects on their blood pressure levels. Alternative remedies that don't affect blood pressure might be recommended for those who need to avoid ginger. 9. Pre- and post-surgery. Ginger consumption around surgical procedures requires special attention. Its blood-thinning properties can be problematic during surgery, increasing the risk of excessive bleeding. This can complicate the surgical process and extend recovery time. Additionally, ginger's effects on blood sugar levels can interfere with the management of blood glucose during and after surgery, particularly for individuals with diabetes. It's generally advised to avoid ginger for at least a week before surgery and during the recovery period. This precaution helps ensure stable blood clotting and sugar levels, minimizing potential complications. Individuals scheduled for surgery should discuss their dietary habits, including ginger consumption, with their healthcare provider. This ensures that their pre- and post-surgical care is tailored to their needs, taking into account any dietary factors that could impact the surgery or recovery process. Key takeaways, and that wraps up our deep dive into the occasions when ginger might not be the best choice for your health. We hope this information empowers you to make informed decisions about your diet. If you found this video enlightening, please give it a thumbs up, share it with friends, and don't forget to subscribe for more health insights. Your journey to wellness is important to us, and we're here to support you every step of the way. Thanks for joining us. Stay healthy, stay informed, and we'll see you in the next video.